In the spirit of respect, authenticity, and reconciliation, the town of Slave Lake honors and acknowledges that we are situated on the traditional lands of Sawridge First Nation within Treaty 8 territory, home to Indigenous, Métis, and Inuit peoples who have occupied these lands since time immemorial. Councillor Gromlich.
I would like to add a closed session under FOIP section 25 to the agenda, please.
Okay, so there's a motion on the floor for an addition to the agenda. So motion to adopt the amended agenda?
Yeah, I'll make a motion to adopt the agenda as amended.
Okay, motion on the floor. Any further discussion? Call to question, those in favor? And that is carried. Okay. Councillor Hughes?
Yeah, I move to accept the minutes of the regular meeting of council from March 18th, 2025 as presented.
Okay, motion on the floor. Any further discussion? Call to question, those in favor? And that is carried. Okay. Public hearing time. So I declare that the public hearing is open and that the hearing is held pursuant to sections 230, 606, and 692 of the Municipal Government Act 2000 as amended. The purpose of bylaw 09-2025 is to amend the land use district map of the land use bylaw 22-2007 by redistricting lot 29 to lot 46, block 1, plan 122-2039 located on 13th Street Southwest from R3 high density residential district to RPSL residential planned small lot district. The notice of the hearing was given in writing to the applicant, the assessed landowner or landowners and adjoining landowners and the planning and development officer. The notice of the hearing was advertised on the town's website from March 19th, 2025 to April 15th, 2025. Any presentations are to be brief and to the point. The order for hearing of presentations will be the planning and development officer, those in favor of the bylaw, those opposed to the bylaw, and any person deemed to be affected who wishes to be heard. All persons giving presentations are to state their name and address at the mic. And just a reminder to council that members of council can ask questions after each presentation and allow for rebuttal from any persons having given presentations.
Good evening, Mayor and Council. So the purpose of this report is for council to hold the required public hearing for bylaw 9/2025. The applicant is the town of Slave Lake, and we are the current landowner of these lands. This is for lots 29 to 46, block 1, plan 122-2039 on 13th Street Southwest. The proposal seeks to rezone the subject lands from R3 high density residential district to RPSL residential plan small lot district to facilitate future development for detached dwelling units on these lots. This rezoning aligns with the goal of increasing housing density in the community. In accordance with section 231 of the Municipal Government Act, Town Council must give bylaw 9/2025 first reading and hold a required public hearing prior to passing a resolution. First reading was given on March 18th, 2025, and the public hearing was scheduled at that time. In accordance with the municipal land use plan map of the municipal development plan, the subject lands maintain a residential and general urban land use designation, and as such, an amendment to the MDP is not required. In accordance with the land use district map of the land use bylaw 22-2007, the subject lands maintain an R3 high density residential district, and as such, requires an amendment. The Municipal Planning Commission reviewed this application at its April 7th, 2025 meeting and indicated their support for the bylaw. Only one plan amendment is required for this application, and as the lands maintain the proper designation with the municipal development plan and area structure plan. The proposal to redistrict the subject lands from R3 high density residential district to RPSL residential plan small lot district aligns with the regulations outlined in the town of Slave Lake land use bylaw 22-2007, and the lots proposed for redistricting meet the required lot size standards for detached residential development as specified by the bylaw. The rest of the reports for.
Any questions from council? Thank you. Now I will call anyone in favor of the bylaw who wishes to speak. Anyone in favor? As I see none. Anyone opposed to the bylaw who wishes to speak? As I see none. Anyone deemed to be affected who wishes to be heard? Okay, as I see none, I will declare that the public hearing is closed. Okay, Moving forward into our delegation from Alberta North Central Alliance. Hey, Jen.
Hello. Thanks for having me.
Thanks for being here. Appreciate it.
So you, ladies and gentlemen, are my 50th presentation of the 3 studies the Alberta North Central Alliance has commissioned. My 50th. We should have.
So we're efficient now. We're good. We got this down
I
pat.
got this done pat. My group commissioned 3 studies, a tourism opportunity, a report, a mental health and addiction needs assessment, and a workforce development study. And so we didn't want to pay for studies just to have them sit on a shelf. So anybody that could use this information we have shared with, we've done several presentations to different ministries, not necessarily ministers within the government, mental health and addiction workers, any organization that could use this data. I'm going to present today what I'm calling the Chills notes. My name used to be Miss Chill back in the day. And so it's the short and sweet version. However, I will provide all 3 copies of the study to the town of Slave Lake for you guys to use however you see fit. But it's kind of been a regional conversation. So as I'm presenting, if there's something you want to stop and talk about, or if you have some questions to clarify, that's great. But in this, to be speedy, I'm going to go through really quickly. And then if there's something you guys want to talk about in depth later or any of those other things, you know how to get hold of me. Okay, so I'm going to refer lots to the region, and that region is that map. So our region is, ANZA represents 10% of the province of Alberta in landmass. And so when I refer to the region, when I refer to the area, it's that particular map with the communities within that piece. And so there's often questions about that, but that is what I'm referring to as the Alberta North Central Alliance for Lead Region, that piece there. We're good. So the mental health and addiction needs assessment, the purpose of this is we know that we have mental health and addiction issues within the region, and there are some communities within ANZA that have declared a local state of emergency, but what actually does that look like? And so this study examined the services that we had, the gaps that there are in the region, and some of the challenges that are in place. ANZA is an advocacy group, so all 3 of our studies, we were looking at what exactly is it that we need to advocate for? What do we need to work towards? But there's also items of action, and that's one of the reasons why we've been sharing these studies is the people who are doing the work need to have the information. So we're the advocacy piece, and then we've been sharing with the action piece. Good. So again, the big piece of the study is, as we're 10% of the province's landmass, we have many remote communities within our region, Slave Lake being one of the larger centers. Slave Lake has lots of the different supports. So what we're seeing across the region is we have either professionals traveling long distances to get to people who need mental health and addiction services, or we have individuals traveling long distances to get to some places to get some of those supports. So we have a significant amount of travel to get to the mental health and addiction services. The entire region often needs to transport to bigger centers. So we have some services here, but quite often people are going outside of larger centers, even within that piece. So the logistics of the travel for any of our mental health and addiction services is one of the biggest hurdles to where we need to be. We have quite a few services within the region. Recovery Alberta, we have quite a few for-profit providers, actually mostly in Slave Lake, although after doing these presentations with mental health and addiction workers, once they found out there was no privatized service in High Prairie area, we have a couple that are coming from there, heading to the other side of the region to provide some supports after some of these discussions, so that's good. There's quite a few not-for-profit agencies. Each nation in ANZA has their own mental health and addictions team of a variety of different size. Lesser Slave Lake Indian Regional Council provides quite a few supports. So we were surprised that there are a wide variety of different supports in this region. Good. There are some strengths. Many of the nations within the region are investing significantly into mental health and addiction. We have a wide variety of services. There's a variety of for-profit professionals providing a different types of services. Big Stone Cree Nation is one of the leaders in the province actually for some of the different strategies that they're using to work to tackle some of this. Recovery Alberta recently has just had a change, and they're offering a variety of different services in the region. Oh, not quite yet. The province is funding for new facilities. We're being told that there's going to be some in Northern Alberta where that's going to be, hasn't been announced yet. There's a wide variety of individual communities that are making initiatives based on what their community needs, which was identified in the study as a plus. Our region has the statistical increase in Indigenous mental health and addiction workers. But it's noted as there was quite a few people in that service that are Indigenous. Yeah, next. So here are some of the stats. 76% of the people in the region that need to go and get mental health and addiction support are leaving our square. 76%. So most people who are being referred out are being referred into that. 71.5% of our mental health and addiction providers are working on grants. So it's a variety of different programs, supports, et cetera. So if the grant changes, if the funding body changes, if any of those things change, lots of those programs that we have change. The top 4 substances in our region that are being treated for are alcohol, opioids, methamphetamines, and prescription drugs. In our region, adults between the ages of 35 to 64 are the highest demographic of people who need addiction supports. But the thing that's interesting is if you think of the bell curve, our tails are starting to curl up. So we're seeing more people between 13 and 17 starting to access services, but that 55 plus is also starting to peak. So the majority is that 35 to 64, but both of our tails are starting to climb up. 36% of our private mental health workers have had to turn people away because they either don't have the capacity or the people who are wanting their services don't have the proper type of coverage for that support. Next. Almost 30% of the visits to our emergency rooms, so ANZA has 4 emergency rooms, High Prairie, Swan Hills, Slave Lake, and Wabasca. Almost 30% of the trips to the emergency room are actually mental health and addiction related, which is significantly higher than the rest of the province. Some of that is because after 5 o'clock, it's hard to get any kind of mental health and addiction support in our region. So people are using the emergency rooms to get support for mental health and addiction purposes. In 2019 to 2023, although this is a stat from all of Northern Alberta and not just from ANZA, 6.5% of our family medical doctors we lost. 2.6 is the average in the rest of the province. I would argue that our area is probably harder hit. Swan Hills, Slave Lake, Wabasca, and High Prairie are all looking right now for doctors and have lost several. So I think that our stat would be quite a bit higher, but we don't have the evidence of that. In Northern Alberta, there's 87 family doctors for 100,000 residents. In the rest of Alberta, it's 116 for 100,000. So not only are our emergency rooms seeing more and more people who have mental health and addiction issues, we have less family doctors per capita than the rest of the province. In our region in 2016, 7.8% of overdoses were from opioid. Now we're up to almost 40% in 2023. More than half of the people who overdosed had a combination of drugs, and 93% had some sort of fentanyl present. Our region is seeing a significant rise in individuals 50 plus that are suffering from fatalities from drug use as well. Next. It was interesting, the study proved that wait time is not a significant issue in our region. What is a significant issue is the spaces between. So lots of times they can find somebody a spot to go to detox, but it's going to be anywhere in Alberta. And actually we have quite a few people from this region also going to Saskatchewan, which was interesting. But it's after detox, how many weeks do you need to wait before you can go to the next stage? So it's to start the process.
You can get into detox.
You can get into detox
The
if you're willing to go anywhere. But then after you go to detox, you need to wait quite a bit of time before you can get to treatment somewhere. And then again, that's going to be somewhere completely different within the province or even in Saskatchewan. So there's different stages. It's the wait times between the stages. We don't have in our region Pre-addiction housing was one of the things that we talked about at the mental health and addiction symposium. Somebody came up that talked about some of those services. We have none of those types of services in our region. We do have some detox in the region. We have a medically supervised detox. Actually, half of Swan Hills Hospital is a medical suite detox. And then there's one in High Prairie that's not medically supervised, although there are trained people there, right? But it's the stages. So what do we do with the people between those different stages is where the study showed. There's little financial support for those who want to go into treatment. So if you don't have coverage through work, lots of people are stated that they don't want to go in if they can't make their truck payments or their house payments, et cetera, right? So if they're wanting to go to treatment and there's no income support for those different pieces.
As well as the cost for transportation in between the various
Cost of
facilities.
transportation between those pieces. Everything kind of adds up, right? There's a want from our mental health and addiction providers for a collaborative approach to a long-range plan for recovery. It's not just AHS, but now it's Recovery Alberta that provides the only mental health and addiction provider. We have a wide variety of providers. There was very much a want to let's sit down together collaboratively and come up with a long-range plan that has lots of voices at the table, as opposed to lots of different individuals coming up with different voices. There's a want and a need for communication and collaboration, mostly communication. So for example, if you are a mental health and addiction provider that does not work with Alberta Health Services or whatever they're called now, you don't have access to Connect Care or any of those other pieces. So there's stories of people being diagnosed with schizophrenia over here, but receiving mental health and addiction services over here, and those two areas aren't talking. There's a concern in our region that we have a high relapse rate due to insufficient aftercare. We have programs for during addiction, but we have nothing before or afterwards. Next, please. Our mental health and addictions providers reported that trauma-informed care would be incredibly beneficial, especially anybody who was, the RCMP kind of had mentioned that was a thing, the teachers. There's a wide variety of people who don't work directly with people but would want a trauma-informed care. One of the actually cool things about the study and sharing the information is I presented that to Little Warriors, who they're a nonprofit group that work with people who have been sexually abused, children mostly, and they have a grant right now and have somebody who's providing training. So they're working in the region. We put them in touch with the school divisions, et cetera, so that people in this region can access some of their services. The majority of our youth receiving mental health and addiction supports are getting it in school, and very few have access outside of school. In our region, if you need to send your child to talk to somebody because they're a little bit sad, grandma or grandpa died, we have that. If they need to talk to somebody that they're hearing voices, you have to be sent somewhere else. There's very few people who have specialized care for children. There's a little awareness of what Recovery Alberta has for services. Actually, they have quite a bit, and they're doing lots of different sorts of things for a region, but there just seems to be a gap between what they have and the communities that need them. Yeah, next. Our education and prevention programs for both mental health and addiction are relying solely on grants. So if something changes with funding models, we would lose those services almost completely in our region. Some groups were reporting that they have low participation, but it was interesting that there's some distrust amongst some different groups, right? So there's some people who would like to send their kid to some of these programs, but are a little bit concerned that there's going to be a call to child welfare, et cetera. So there was a little bit of a disconnect between some people who need the services and some people who have the trust to take the services. It was enough that it came up in a study, and that wasn't even a question, to be honest. There was some people who reported that they don't trust some of the services that we have region-wide. We've had, again, this was something that they reported voluntarily, but many people from this region have gone to either Grant Prairie or the Alberta Mental Health Hospital for formalized assessments just to be told that they were fine to be sent home. And so that was interesting, again, that came up enough in a study because that wasn't one of the direct questions, but there was quite a few people who mentioned that. All workers within our region rated crisis intervention in inpatient mental health facilities as somewhat or completely insufficient, especially for children. And transportation of clients to and from services was an area of concern of all staff who did the study. Next. 82% of our mental health and addiction organizations are understaffed. or are hiring people that don't have the proper training because they need to have a body. Many of the individuals with lived-in experience, you know, if they've been clean for 15 years or they had suffered some significant mental health issues, but have had the help to do that. They would like to work in the industry, but they're often restrained by not having the formal education or having a past criminal record, et cetera. So they're being limited to where that they could work. That workforce in particular has an incredibly high turnover rate. Besides a strong local base that we're able to retain, that's something that's always worked for this region. If we can train the people within the region to get the courses that we need to stay within the region. But again, it comes back to, and every single time we'll talk about housing has popped up in all three studies, that it's an issue that if you wanted to bring somebody here to work here to do those things, that to provide a place for them to stay would be difficult. All of our mental health and addiction workforce, many of them asked for professional development opportunities. It was interesting. One of the groups that we presented to was Northern Lakes College, and they asked, give me a list, and we will see what we can come up with to support that. So it's been interesting to go across different places and have lots of different players within the region have the information and have this conversation. Many of the workforce, the mental health and addiction in our region require mental health supports themselves. And actually in our region, we don't have anything formalized to help the helpers. Often they don't feel like they're even should be using their benefits to access services when there's so few services for others. Next, please. So what is it that we're missing? We need an integrated approach to service delivery, helping people with their mental health and addiction, but also with housing, employment, justice services, physical health. Other regions have kind of wraparound supports. You have a person and they go through all of these different sorts of things. Let's get your driver's license. Let's get you into school. Let's deal with your lawsuits or criminal record, all those other things. We have that in the region, but nothing wraparound. You have to go from a different person to a person over here to something over here. We need after-hour cares, especially for emergencies after 5 p.m. The only services that we have in our region are the 1-800 numbers or the 1-900 numbers, et cetera. We have some services for people who are attending treatment, but we have very little pre or post. And if you're just going to treatment and you're coming back and you're going into the same lifestyle and there's no supports and services, it's an issue. We need more medically supervised detox. The 2 facilities that we have aren't sufficient for the number of people that need it, especially the medically supervised with the increase of opioids. Sorry, next. Expansion and outpatient care. We have very few sober living facilities. Support for children and family care. There's other regions where, you know, if your mom or your dad's going in for treatment, that afterwards there's housing that you go to at this family and there's programs for kids to talk about some of those different sorts of things. We have a lack of providers for mental health and addiction in the West End, although, like I said, there's starting to be some move over. We need some collaboration between the social and the economic determinants, right? You can't just send someone for treatment without needing some of those other things. Culturally appropriate mental health support for off-reserve and Indigenous run facilities. Youth, mental health support for youth came quite heavily. But transportation scales on a regional scale, how do we, if we have all these people who need treatment or need these services and they have to travel outside the region or within the region, you know, how do we do that? Right now, it's often done by an RCMP or a Lakeshore Police or an ambulance, but we have very few of those as well, right? So lots of times we have our limited services that we have transporting people for the services that they need, but we need something better. Next. High priority is how do we need to stabilize that workforce? How do we advocate for more services and for an expansion when we can't even maintain what we have with the workforce that we have in place? We need to advocate for increased communication between all healthcare providers. If we have something like Connect Care, it shouldn't matter if you're on reserve, off reserve. I didn't realize that even ambulances don't have access to Connect Care for some of those very key kind of pieces. And so there's a little bit of a disconnect there. We need to take the pressure off of our emergency rooms. 30% is quite high. And there's a wide variety. Next. So that's that. I think I did pretty good for pretty quickly, but if anyone wants to stop and ask some questions, again, if there's things that I missed, I skimmed over, but.
No, really detailed, appreciate that. And there's Any questions on study one?
On study one.
Before we switch gears, Counselor Hughes.
Not necessarily questions, just general comments. I mean, I think I don't find a lot of this surprising necessarily, you know, the transportation needs, a lack of communication, collaboration needed. I think to hear that 76% of people leaving our area are seeking support, that's a staggering number to me. That definitely deserves a lot of time and attention paid to it, for sure.
And we have a few within the region that are
Yeah.
full all the time, right? But if you need something quick, they're leaving the region to go get those supports.
Yeah, yeah. And I mean, I think even, you know, thinking back to a couple of years ago during the COVID phase of life as well, you know, it became really apparent that there was a lot of kids, especially needing some sort of support system, whether it was, you know, based in school or not.
Yeah.
So to see that that's still a trending thing is also, you know, highly concerning and needs to be advocated for heavily. You did mention, so we're the 50th study that you've done.
Mhm.
So you said, though, you are seeing some positive impacts when you're relaying this information already in terms of collaborations and people kind of changing things up.
Absolutely. Well, like I said, it was one of them was, you know, the little warriors. And it's like, oh, actually, we have a grant right now where we have this person that's doing this training. Please give our number to the school divisions and anybody that wants this particular training. Right. Meeting with Northern Lakes College and they're, you know, wanting to a list of some of those other things.
Yeah.
There are some groups now that, you know, we had a conversation about the pre-treatment housing and there's some nations that were like, maybe that's something that we can look into. Can you send us Earl's number and some of those other pieces? So it's caused a really interesting conversation, but
That's
there's
good.
lots of different people. It's too big of a problem for one group to do everything. But if we can get 10 or 12 or 13 different groups doing different things, or at least putting it out there of what we need
Yeah.
and what our other groups are trying is.
And I guess that kind of leads me to my next question. What happens after this? So in terms of what ANSA has, you know, asked you to do, you guys have gone through with the study, you presented the study, but then what? Is there a next step in terms of your group or anything like that that's kind of been
So
detailed?
we've asked anybody that's going to use the study, if you could just let us know how you're going to use it for such, right? So there's
Okay,
some groups
yeah.
that are going to take some action and, you know, ANSA can write letters of support, et cetera, for any groups that want to take on some of these action pieces. The next piece of our research, because we run on an ACP, which is formed around, you know, the research piece is looking at housing and some of those other key issues, right? But the other nice thing, and when you see the reports, it clearly lists the items of action and the items of advocation. So after we've done these things and collected some information, what is it that we need to start specifically advocating for? Because just to
Right.
tell somebody to do better isn't good enough, right?
Yeah.
So if we have some specific items, here's, you know, how do we slowly start a ball rolling? What are some things that are small and manageable to start and go from there?
Right, okay.
Mhm.
Yeah, it just makes you think, you know, if people are starting to fill in the gaps, it would be nice to have one central group that kind of has that information and we can kind of keep things moving and keep collaboration open, right?
It's been interesting because there's other groups that have now given me their study, right? It's like, oh, we did this type of, because there's all this information floating out and instead of
Yeah.
having every group paying for a study.
And the point was to have between all the municipalities, nations, and our municipal districts to be able to have access to that. So
Mhm.
should there be something that your municipality or nation is advocating for, then you have
Yeah.
that.
some
So
data and-
when we go to do meetings with the province, we have
Mhm.
access to the study and access obviously to Jen and Alberta North Central if there are some key points to highlight.
Yeah.
So that was kind of the point behind formalizing all of the studies, is so that
Mhm.
someone's already done this, but for the region, because
Yeah. it's-
yeah.
Well, we haven't really done that before, I
No.
would say.
That's just one
Yeah,
minute.
This
that's what I
on
mean,
this
that's what I mean.
scale,
Now
in
we can
this
use this.
particular square, as you call it.
Yeah.
Hasn't been done. So,
Agreed. Counselor Adams.
Would it make sense to have ANSA take more of a leadership role in where that's going to head down so that you have multiple groups advocating? Because I mean, I look at Canuso and the challenges there around youth and mental health. That's nowhere near our department, but it is definitely part of our community. So I find it difficult if that's looking just from a town piece as not ranking high, yet for the other area, it's very high.
Well, and some.
And we are
communities-
together. So is there something that we can bring that all together so that we're moving multiple municipalities in the same direction instead of each of us picking our own priority.
Right. And so there's been conversations around that as well. Like, well, we'll go to the tourism, for example, right? So some of it was, there was a SCOP grant and how do we communicate about who's applying for what? So none of us are replicating those pieces, right? And so in terms of mental health and addiction, if somebody wants to, how ANSA kind of sees it to be, is if somebody wants to start a project, ANSA can write a letter of support, but the town of Slave Lake also can write a letter of support, and the MD of Opportunity could write a support, and Big Stone Cree Nation could write a letter of support. But it's that communication piece of, oh, what do we have, what are we missing, and who are the key people and what are they doing, which I know doesn't sound, but it's been a huge undertaking to get all of our ducks in a row. I keep saying if we ever get all of our ducks in a row, this region could fly, but we have a lot of ducks that are working in different ponds that aren't really talking to each other. So some of it is just determining who's doing what, who can do what, and how do we kind of move together and coordinate some of those pieces.
And I think it's awareness among all the councils of the various municipalities and meeting once every quarter so that we're able to communicate with each other and find out what everybody else is doing instead of in a silo. So if a council decides to make a move on a mental health addiction proposal to the various levels of government, then they have access to this study, and then they can contact everyone else through ANSA and say, hey, here's what we're putting forth, you know, are you guys in too? And kind of go from there is where we've gotten so far.
We've met with a few people as a group, right, to kind of have that unified, this is a problem is with the region, right? This is not a you problem or a them problem. This is an us issue. And so how is it us do we deal with some of these messes, right? And some of it is having the conversation and making sure everybody's in the loop, but also having an idea of who can do what and how that works. Can't make it worse. Keep saying it can't make it worse. When I was presenting to the mental health and addiction workers, they went, this is really depressing, Jennifer. And I went, yes, but just imagine what it would be like if you're not doing what you're doing already. Right? We have lots of really good things happening. That's the depressing one. So let's move on to the happy.
Okay.
A little bit, let's feel a little bit better here. And so let's talk about tourism. So the number two priority for ANSA was the development and promotion of tourism and Indigenous tourism. We've been working with the Regional Tourism Society, a few other different sorts of elements to promote that tourism piece. And so we did a study on the recommendation of Travel Alberta that there hadn't been one done for just the region. There's been a couple for communities and a couple for Northern Alberta. And so the purpose of this study was to, again, list of items of action and items of advocacy to support our tourism within that square. Next. So this is from the north. In 2019, they did a big study for Northern Alberta where they indicated that there was 1.61 million tourists that come to Northern Alberta. I don't have any specific number recorded for us as a region. Actually, what we need to do better at is start counting for everything. I don't know how many people within the region are being turned away for supports. I don't know how many people are coming into the area. We don't know. We're not counting. So if we could come up with something with all the ducks that, hey, this is what we need to count so that we can try to get some support. How do we all agree on what we count and how do we share that so we have a better idea? So these stats come from Northern Alberta. Most people are coming to the region between April and September. That would be no surprise. Most people are coming to stay with friends and relatives, repeat visitors. Most of the visitors that are coming to Northern Alberta are from Southern Alberta, BC, and Saskatchewan. That study indicated that there are very few international visitors. I'm the president of the museum in Canuso, although I would say that most of them are probably from other regions in Alberta, BC, and Saskatchewan, but we see quite a few international tourists, mostly going up to see the Northern Lights, to be honest. So next. So in 2019, the tourism sector contributed $51.5 million to the GDP. It fell 46% during COVID. I'm presenting right now to a variety of tourist operators for these last few weeks. They're very surprised because they've seen an uptick actually during COVID, but we are outside tourist operators, right? So lots of the campsites and lots of the parks and et cetera actually reported an increase. We lost, as a region, we've gained all but 5% back, and we're expected to pass that by some point in 2025. We lost in our region 478 tourism jobs during COVID. And as of March 2024, we had 800 of the 1,000 back. But lots of that is seasonal, to be honest. Next. There are tons of different grants right now available for a variety of different tourism pieces. Tourism is something that both the provincial and the federal government are interested in supporting at this time. I heard that you guys have got your SCOP. You were part of that, all 9 municipalities working together to determine, make sure we're not applying for the same thing. How do we coordinate those pieces? So congratulations. But there are lots of opportunities right now for municipalities, nations, and individual tourist operators to apply for a variety of different grants with the tourism piece. Next. So what did our study say? Special events and camping are the 2 kind of key pieces for our region in terms of tourism. We have big, huge events like North Country Fair that bring quite a few people. Driftpaw Powwow brings quite a few people into the region. And then we have camping. Many visitors into our area are repeat visitors. We have a significant amount of local tourists. So people from Slave Lake going to the High Prairie area and around, or actually what it is a lot of is, you know, my aunt from so-and-so is here. Let me take them around and be the tour guide for a piece. Typically our visitors stay for 1 and 3 days, but we have something interesting where we have many people live here. We have communities like Fost, Jussard, Gruard that probably quadruple in size in the summer because we have people who are buying properties that typically would be housing and using them as a summer house. We have snowbirds who go down south and then live in the area along the lake in the winter, which also makes it interesting for housing. They're spending about $100 to $200 a day. 62% reported that they aren't staying in hotels in the region, not because they didn't want to, but because they couldn't get in. So we have tourists that aren't being able to access, and that's along the whole region, not just in Slave Lake. Next. 50% were satisfied with the restaurants and cafes, but I thought that was interesting. But then when I looked through, I don't know if you know this or not, but Red Earth does not have Starbucks. I don't see that they're going to get Starbucks anytime soon. So it's people from different areas coming to more of our remote communities within the region and being a little bit disappointed that they don't have Skip the Dishes, etc. into some of those places. So some of the stats are kind of interesting. Almost 60% of the people who did the survey, and this one had, I think it was 1,800 visitors that came through, did not use the Travel Information Center. And those that did, only 15% were satisfied with the service. The only Travel Information Center in the region is the one that the town of Slave Lake operates with the MD of Lesser Slave River. Wabasca is no longer operational, and Big Lakes County and High Prairie aren't using theirs anymore either. So that was something kind of interesting. Something that's sad is 19% of the people who did the study, and again, that they went to all the big kind of events within the region, only 19% were satisfied with the region had to offer. But what it is 70% didn't know what existed. So they're coming for North Country Fair and don't think that there's anything besides North Country Fair. They're coming for Beach Fest, but not knowing or not experiencing things outside of that. So they're happy with the event that they're coming to, but aren't happy with what the region has to offer, mostly because they don't know what exists. We're not doing a great job of promoting ourselves. Campsites, restaurants, and cafes are our most heavily used tourism facilities. Next. So what do they want? And this is when we're presenting to the entrepreneurs of our region and we're having the conversation about those pieces. This is some of the ones that they're very interested in. Local food and drink experiences, but we have some. We have, like, there's the farm in Fost and High Prairie. Actually, the winery in High Prairie is winning Canadian awards for some of their wine. We have the Dog Island Brewery here, but they're looking for more of that. Family-friendly activities that are always open. If the lake is rough, you can't go fishing or swimming that day. There's not a lot to do that you can take your whole family to go do something. Adventure activities, Indigenous tourism opportunities came up over and over and over again. Wellness and relaxation, guided tours, we could not find one. There's not a guided tour facility in this region where you can have somebody take you out in a boat or someone take you out in a quad or someone take you out on a horse, etc. Rentals was something that was asked for over and over again. Interesting places to stay, although there's some of that being developed. Self-guided tour, but something that they asked for that wasn't even an option is information about what the region has to offer. Some of it is most of our tourism operators aren't online. There's a significant gap between our tourism operators and their footprint online. The Regional Tourism Society that is now regionalized, when they sent out that package, we had two website developers from the region offer a discount for here. If you would build a website, we can give you a discount for those piece. Very few of our operators are registered on ATIS, which is the Alberta Tourism Information System or something like that. And so you have to kind of know a guy to get to some of our amazing tourism opportunities. And so work with the Tourism Society to make a list, something like 300 tourism operators in that square. So we have a tourism industry. We're just not doing a great job of highlighting it. Next. So our tourism operators say that many of our tourists are retired or people with families, but we also have a high population of Indigenous tourists as they're coming up for powwows and ball games and different sorts of things. We are the busiest when there are events taking place, and we have some big ones. Lots of them are return customers. But our operators are struggling with promotion and being able to direct their tourists to other operators. So they have tourists there. Where else can I send them so they're not just with me for those little bits? We have that disconnection again. They're asking for our locals to be our area ambassadors, right? So if you stop at a restaurant and, hey, what's there to do? I'm driving down to wherever, the answer is they have something to say would be nice. And they're also looking for other operators and groups to collaborate with. Next. So out of the recommendations from the action plan, the Regional Tourism Society is taking care of 7 of those. So lots of the different recommendations that were come from that study and lots of those pieces is the Regional Tourism Society. Once they have the grant to do that, lots of those things will hit theirs. Something that ANSA is going to continue to have to look at is we're not on Travel Alberta's website. We recognized on that case yet are highlighted within that piece. We have a meeting May 9th, I believe, with Travel Alberta to present this study and have the regional conversation about we've done everything that you've asked. So now how do we keep moving forward? Community Futures is aware that, there's some business supports that are needed. And so most of these recommendations we are already on. Next. And then afterwards, this is mostly where I've been having conversations with tourism operators. I met yesterday with 9. I have 37 registered this week and more happening next week. Most of it is we need our tourism operators to kind of do some of these pieces. Register yourself on ATIS, participate with the Tourism Society. Let's start putting some of those pieces together. Next. So that's the tourism study again, or the chills notes. Again, there's quite a bit more within there, but that's just kind of the overview and highlight. Questions or concerns about that? Councillor Hughes.
I can't pass up the opportunity to comment on tourism. I appreciate the report that you gave. The statistics are no huge shocker to me whatsoever. Those are all items that the Tourism Society has been actively noticing over the last several years. I was making notes on all the things, and at the end you remarked that we would be taking care of 7 out of 10 of those, and that's kind of where the rest of my notes were going to go. But I do think it is important to highlight kind of just that fact that events and camping are the main drivers bringing people here.
Yeah.
And just, I think the overall, note to think of here is that we really need to build out a unique accommodation and unique experiences for people to kind of vary ourselves a little bit here, and just building on those experiences, circle tours, collaborating, and communication. And so, those are obviously, the top kind of things that the new regional board will be striving for to kind of meet the demand and kind of help us refocus and meet these action items as needed. So,
well, and we have lots of creative entrepreneurs that are already doing some great things. So how do we take what we have and connect them up a little bit and highlight what's there? Because we have some people who are doing some wonderful, wonderful things, right?
Mm-hmm.
So
yeah.
Lots of it's
and
already there.
it's just relaying the information at the end of the day. Like you said, there are a lot of people that don't have phone numbers listed or they don't have a website. Some of them, though, also have remarked, and I think you've heard this as well, that, well, I don't need to do that. I'm busy enough as it is, right? So you find an interesting kind of mixed bag of, unique people with unique businesses, and not everyone wants to advertise online as such. I did also want to let you know, though, there is a guided fishing tour.
Oh, is there?
So yes, that did not come up in your report, but there is a guided fishing tour in the areas.
Good.
That's it for me. Thank you, Jen.
Okay.
Oh, wait, last one. which is
Is
my
it sad or
favorite.
happy? Where do we go next?
This one is interesting. So this is the labor market study. And so and maybe this is my favorite because it goes to my past life as a teacher, but I'm going to give you the answers up front and then we'll talk about some of those things. So our labor market study was interesting compared to some of the other ones in the region because we have two things happening at once. We have a mismatch between residents, employees who are frustrated that they can't seem to find a job. And then we have employers that are frustrated that they have nobody to hire. How does our region have a unemployment rate and a job vacancy rate at the same time? The issue is skilled labor. We have a labor shortage, but the population that we have doesn't necessarily fill the job requirements that we need. We also have an issue with housing, as we've talked about before, and a consistent way to find job postings. We had so many people do this study because they gave away iPads. I think there was 6,000 people that responded. This one had a lot of data to go through. And so we have this huge disconnect between our employers and our employees, and even a huge disconnect between the people who are providing services and the people who need services. Again, it's a big disconnect. Next. So our population had a 3.3% decline from 2021, and it's mostly younger adults leaving the region, that 20 to 30-year-old gap. Here's something that was staggering to me. In our region, 1 out of 4 adults between 25 and 64. So I'm not talking about the young kid that's just lost themselves that haven't quite got onto their feet yet. 25 to 64. 1 out of 4 in our region don't have their high school diploma. In Alberta, the average is 1 out of 10. So 25% in our region between 25 and 64 don't have a high school diploma. In the province of Alberta, it's 10%. Huge discrepancy. 26% of our residents within our region have a high school diploma or a GED, or that's it. So 51% of our population have a GED, high school diploma, or nothing. Do you see already where we're having the problem where we're having a labor shortage and an unemployment rate at the same time? 20% of our region have a college credential. They were very generous. Level 1 of a childcare, they called the college credential, like any kind of college credential. 11% have a degree, 4% have a master's. This staggered me. 11% of people in our region have a journeyman ticket, which include class 1. So how do we have such a high level of people who participate in the trades, but aren't being formalized? When I had this conversation with Northern Lakes College, one of their comments was, and we have a hard time finding anybody who will take on apprentices. Well, if we only have 11% to have the actual ticket, right? But if you think even within your family and your friends groups, how many people do you know that work in the shop as a mechanic but don't have their journeyman, or work as a carpenter but don't have their journeyman? Next. So as of 2023, we have over 1,000 businesses registered, 539 in Slave Lake and 254 in High Prairie. The rest spread in different parts of the region. Again, that's registered businesses. We've seen a 6% decline from 2022, something that our region was staggering compared to the rest of the province. 39% of our businesses have existed over 20 years, which is really, really good. But that's a little bit skewed because anytime an oil company changes the name on the door or a lumber mill changes the name on the door, that resets the time. Our top industries are oil and gas, mining, manufacturing, public administration. Next. So there is our GDP as the whole region. Can you kind of have a guess of what we're booming and busting with? Right. Next. So there it is compared with the province of Alberta. So typically our economy is stronger than the province of Alberta. Right now we're lower. And so I said to the mathematicians, I said, listen, I'm just a lady from Canuso. Can you explain this to me a little bit? Because I think I'm smart, but I don't get it. And they said, the problem is our economy can't grow. Our labor force is slowing down the growth of our economy. So now for the first time in quite a while, we are less than the average of the province of Alberta because we don't have the labor force to sustain the growth that's needed. Next. And so the small businesses in our region are, that's typically, we have lots of construction and equipment. We have a staggering amount of equipment, small business owners who have equipment in the region, retail. And so when they talked to some of the individuals who have the small businesses, they asked for assistance with grants or informations about grants, employment training programs. 54% would consider using the rural renewal. Something that was asked for over and over again was a business directory to help find subcontractors. If you need to find a plumber, you have to know a guy who knows a guy, because there's no more yellow page where you could just look up and have a list of all the people in the region. So there's a disconnect there too. We have, some groups that are like, well, where does everybody else find these contracts and these work? I never hear about a place to put in a bid. And then we have people who are looking for contractors that feel like they're putting out bids and they're not getting a lot of answer back. Next. So our employers when we asked what is the issue when you're trying to hire, lots of it was lack of qualifications, housing options, education. Sometimes they have the education, but they don't necessarily have the skills. Public transportation came up as a pretty significant issue, which I was a little bit surprised at, even though we don't have public transportation, but I just have never lived in a place that had it. So I never would have thought that that would be an issue. But if you're moving up from the city, expecting that you can carpool to Canyon Creek every day or wherever, that's probably an issue. Next. In 2021, the average income in our region was 45,000, which is higher than the provincial average of 40,000. In 2021, the average household in our region was 80,000 compared to the average of 83. But to be completely and totally honest, there's a huge discrepancy within our region. There are some communities where the average income is significantly higher than that. And then there's average communities where that would be significantly lower. We're a region of haves and have-nots. Housing is increasing again. That's an average between all the different communities within that square. Something I found is interesting, 64% of our workforce commutes within their local area. So that would mean, the people going from the town of Slave Lake out to the Mitsue, which would be in the MD of Lesser Slave River, or over from Canyon Creek into town. But 31% travel within other areas. So that's like someone from the town of Slave Lake going to somewhere within Big Lakes County or up to Wabasca, et cetera, some of those other pieces. So that is 95% of our population within our region are traveling some sort of distance to get to work. So between that and all the travel for mental health and addiction supports, no wonder why our roads are the way they are. We are on them often to get to work, to all those pieces that we need. Next. 70% of our residents have lived in the area for longer than 10 years, which is again statistically higher than most places in the province. But 60% of the people who did this study said that the cost of living is making them think that they have to go back to school or they need to get some more training, that they're having a hard time making their ends meet with the training that they have. 50% say that they would housing is an issue if they were going to go to school or to get a different job. That's hard to do if they don't have a housing option. 54% said that they would take advantage of employment or local skills training if they were aware of what they were. Huge disconnect again. Had funding to attend or were more flexible to their work schedule. Even people who have quote unquote funding to go to school, it's hard to live off of your limited school funding to go to school full time and all those other different sorts of pieces. Next. And so when I talked to the province of Alberta, to different ministries and staff within that, it started that I started with that stat and the next thing you know, I had more requests for meetings because they were surprised that 79% of the people within our communities don't know what resources exist to help them get a job, to help them start a business, all those other things. But we have people in offices all over this region that's their whole job is to help people get access to those skills. So again, we have a disconnect. People in offices that have these supports and services and the people who need them, they're not linking up there. A list of current job opportunities in the region. Do I go onto Facebook? Is it on Indeed? Where do I have to make an app to go in to do those other pieces? Yeah, next. So what are the gaps? What do we need? Healthcare, all types. Social assistance, most of the nations within the region are building their own mental or their own social services. They're on different different parts of that. So as all the nations have their own social services as well, that's going to even have more of a pressure there. Social assistance, all the mental health and addiction workers fall into that too. Public administration, you guys would know, as do the other members of ANSA, that, you know, everybody's looking for executive directors and human resources and accountants and all those other different sorts of pieces. Transportation workers, class 1 especially, school bus drivers was something that's needed. Skilled trade workers, name the trade, we need it. Education services, not necessarily just teachers. When Northern Lake Scarlet started offering education for teachers in the region, that helped, but it's also like occupational therapists and speech therapists and lots of those really specialized services that we need within our schools. Paraprofessionals, office and court data support, IT was number 9. And then number 10 was tourism and service industry. Some of that is, you know, people who are in the tourism industry as they're going to school to get training for something else, or it's seasonal, et cetera, et cetera. Next. So recommendations from the report, lots of these things our region is doing, but how do we do better at it? And so as we've presented to, you know, the school divisions and lots of these Rupert's Land, all these other groups, they're kind of requesting, let's sit down and how do we streamline some of those pieces? Our high school and post-secondary to strengthen that partnership, closing the gap for high school completion. We need to get more people with the training that they need to move into the workforce that they need. Affordable housing and a regional housing and strategy, increase employer engagement. How do we fill in some of those gaps with the services that we have available to help small businesses? Our small businesses aren't accessing them. So how do we, the people who are in the offices that are there to support that, how do we bridge those? A regional business directory, but lots of it is that relationships and partners between different groups who are needing something and the communities that need it, or how do we kind of work together, all the services we have in place, how do we streamline that a little bit better? I think that's it. One more? Just questions about that one?
Condensed it.
I did. They're all 3 reports together, about 90 some pages. And now I've had conversation with all these different groups all over. I know lots of things about lots of stuff
things
that
about
is
lots of things.
happening.
Councillor Adams, go ahead.
Are you supplying those reports automatically, or do they have to have a formal
So
request?
they'll go to you automatically, right? But if you're a mental health and addiction provider, all we've asked for is give me kind of a letter about what you're going to be doing with the study and what your goal is. And some of that is just to have an idea of who's doing what and what does that look like on a
Right.
regional scale to kind of keep track of some of those pieces.
Thanks.
Anything further from council? No.
Look, I did less than an hour.
I really appreciate.
Right.
We appreciate the incredibly detailed reports and again, for our administration, if we need access to any of these, that's where we get them.
Well, you guys know how to get a hold of me. So if you're thinking later, hey, I want to get some more information about, or hey, what do you need to know about some of those other different sorts of pieces? Or if there's a group that you think I should talk to, as every time I present, about 5 more requests for presentations come up, right? And usually it's more of a conversation piece, but if there's, you know, somebody for you guys for some sort of information, send them my way and we'll include them in the loop.
Appreciate that.
Thank you.
Thank you.
Thank you.
Thank you. Councillor Gramlich,
Make a motion to adopt the report as information.
any further discussion? Call to question, those in favor. And that is carried. And if we can get a 10-minute break, please. Thank you.
Right, good evening, your worship and members of council. The purpose of this report is just to follow up on the public hearing with respect to amending the land use bylaw number 22, 2007, redistricting bylaw 09, 2025. The gist of it here, the planning department doesn't have any concerns with the current bylaw and is looking for second and third reading.
Okay. Counselor Adams.
I know I've said this before anyways on what I had said, thinking that if our priority here is to increase density of housing, this is not the way to do the increase in density of housing, even though we said in the report that it is. It seems backwards to me. It is actually lowering the density that's allowed in that area. But you've heard me on it, so I'm not going to ramble on that. And otherwise, the bylaw seems pretty straightforward.
Sure.
Counselor Gremlin, thank you.
You're welcome.
Thank you.
I would like to move that bylaw number 09-2025 to amend the land use district map of the land use bylaw number 22-2007 by redistricting. Then I'm going to cheat a bit.
Yes.
Plan 122-2039, block 1, lot 29, lot 30, lot 31, lot 32, lot 33, lot 34, lot 35, lot 36, lot 37, lot 38, lot 39, lot 40, 41, 42, 43, 44, 45, 46 from R3 high density residential district to RPSL residential plan small lot district receives second reading.
Motion on the floor. Any further discussion? Call the question. Those in favor? And that is carried. Counselor Choba had his hand up first.
Oh, chiming in.
Caught it.
Okay, I'd like to move that bylaw number 09-2025 to amend the land use district map of the land use bylaw number 22-2007 by redistricting plan 122-2039, block 1, lot 29, all the way to 46 from R3 high density residential district to RPSL residential plan small lots. District receives third reading.
Okay, thank you. Motion on the floor. Any further discussion? Call the question. Those in favor? And that is carried. Thank
You
you.
took a shortcut on my shortcut, man.
Continuing on your next report.
Okay, I think the next one we have is bylaw 10, 2025. The purpose of this report is to give bylaw 10, 2025 first reading and set the date for the required public hearing. The name of the applicant is Big Fish Bay Report. The proposal is to amend the land use bylaw by adding section 115A, recreation facility and resort district. In accordance with section 6921 of the Municipal Government Act, Town Council must give bylaw 10, 2025 first reading and hold a required public hearing prior to passing a resolution. The Municipal Planning Commission will review the application and bylaw at its May 5th, 2025 meeting, and as such, the recommendation is forthcoming. For the Planning Department, they have no issues with the application at this time. The owners of Big Fish Bay have applied to amend and to add section 115A Recreation Facility and Resort District to allow for specific developments for cabin development to meet their future business plan. With that, yeah, the Planning Department has no issues, and I'll leave it at that.
Counselor Hughes.
I move that bylaw number 10-2025 to amend the land use bylaw 22-2007 to add section 115A Recreation Facility and Resort District RR2 receives first reading and the required public hearing be scheduled for May 6, 2025.
Motion on the floor. Counselor Adams.
Sorry, just for clarification, if you can, maybe you can answer. What is the timeline that's required for public notice?
I believe it's 2 weeks.
It's 2 weeks.
So May 6th is enough time?
Please.
By the time we get it posted, isn't that a day short?
Well, if it's posted
We have it today.
tomorrow,
Yeah. She should have.
that will
applied it
give
out.
2 weeks would be the 30th of April.
Okay.
So it'll be almost 3 weeks, a day shy of 3 weeks.
Okay, thank you. Sorry.
No worries. Any further discussion on that? Okay, call the question, those in favor? And that is carried. Continuing on, Roland, we
Right.
should have 11/2025.
So the purpose of this report is also to give first reading to bylaw 11/2025. The name of the applicant is Big Fish Bay Resort. The proposal is to rezone a portion of the above noted site from RR1 Recreation Facility and Resort District to RR2 Recreation Facility and Resort District to allow Big Fish Bay RV Resort to further grow and expand their site. The Municipal Planning Commission will review the application and bylaw at its May 5th meeting. As such, their recommendation is forthcoming. The bylaw is being introduced to council for first reading and to set a date for the required public hearing. 2 amendments are required to facilitate this application, and as such, 2 amendments to the land use bylaw 2022-2007, one regulatory and the other districting are running concurrently. The owners of Big Fish Bay purchased lands adjacent to their current operations in 2021, and at that time applied to amend the municipal development plan to facilitate future growth plans. They now have applied to amend the land use bylaw to add section 115A Recreation Facility and Resort District RR2 to allow for specific regulations to allow for cabin development to meet future business plans. They've also applied to redistrict the lands they purchased from R1 to RR2. The planning department has no concerns and recommends council give bylaw 11/2025 first reading and schedule the required public hearing for May 6th.
Counselor Adams.
Move that bylaw 11-2025 to amend the land use district map of the land use bylaw 222007 by redistricting 16.37 hectares or 40.45 acres of the subject parcel of land at SW1 73-6 west of the 5th meridian from RR1 Recreation Facility and Resort District to RR2 Recreation Facility and Resort District as shown on the attached sketch plan. Marked as Schedule A and forming part of this bylaw receives first reading and the required public hearing be scheduled for May 6, 2025.
And can we just get Counselor Choba's, like whatever the screen is so that I can actually see him? So it's about yay big. Perfect. That helps. It's helpful. Okay, motion on the floor. Any further discussion? Call the question, those in favor? And that is carried. Right, Roland, continuing on. Your
All right.
moment.
For our next
Your
report,
moment.
I'm here to present the audited year-end financial statements. With me is Edward from Doyle and Company, the auditor that has audited the town's financial statements this year. For the flow, I'll let Edward go and kind of give his assessment of the year end, and then we can kind of jump into the report. It's a fairly lengthy report. I believe it's about 15 pages. I'm not going to read it word for word. I will kind of summarize some of the highlights, and if there's any questions, please ask.
That works for us. Thank you.
Thank you guys for having me. Thank you, Roland. My name is Edward at Doyle and Company. I'm a partner there. I'm also the engagement partner for the town of Slave Lake. So I've read over the report to council. It's got a lot of information in there. I did bring this, I did mention this to Roland as well as to the council, that it is a really detailed report. Probably one of the more detailed reports I've seen. Has lots of information, lots of good transparency there. So good job, Roland, on that. So as an auditor, what we do is the town of Slave Lake prepares its financial statements. Us as auditors, we audit the financial statements. Okay, so the traits that we have are independence. Myself, I'm also a member of the audit team as well, and my staff. We come to the town, so pre-engagement, I kind of break it down into 3 phases, right? So pre-engagement, before we even step into the door and take on the town of Slave Lake as a client, we look to see if there's any independence impairments there. Not just to myself, but to our team as well. Okay, if at any event or any issues with any one of the team members that are out of the audit team, a new person comes in that's independent. Okay, that's extremely important for us. So, we do that as a pre-engagement phase. We have one in the middle. We reassess that whole thing again, and then once again at the end before we form our audit opinion. That gives us the ability to be objective, to be skeptical of the financial statements, and then for us to issue our audit opinion, right, which is what everybody wants to see. So, with that said, we are issuing a clean, unqualified audit opinion for December 31st, 2024 for the town of Slave Lake. With that, when we do come here and audit, we look at your internal controls. We use those internal controls in order for us to come up with audit procedures and then test specific items of your balance sheet, your income statement, and overall the town in itself, right? So we gather all this stuff. We come out a few times a year. Like I said, we come out for an interim trip. We come out in a final trip. And then we gather everything we can, and then we formulate our opinion for that. Okay, so we haven't noticed any instances of fraud. So that's good. And, all the controls here, there's good segregation of duties. Everything seems to be working the way it's intended to. Okay, and like I said, when Roland gets to his piece on the financial, all the detail in the financial statements, he's going to have a lot more of that. I'm just going to go through an overview of all the numbers. And then you'll have him explain everything else. Okay, so we're going to start off on the statement of financial position. So your total financial assets, which is made up of your cash and cash equivalents, your receivables and your investments total $22,644,147. These numbers are all at December 31st, 2024. Your total liabilities for the year, which encompasses your accounts payable and accrued liabilities, deferred revenue, long-term debt, is $24,662,442. That brings you guys to a net financial debt of $2,018,295. That's a decrease of $2 million. An increase of $2 million in your net financial debt, right? So, when we look at the debt, it's the lowering. So it was 4 million last year, it's 2 million this year. Okay, your non-financial, that's before your non-financial assets, which is made up of your tangible capital assets at $176 million. Your inventory, which is 308,000. We'll get into the accumulated surplus in just a second. So for your consolidated statement of income, your revenues total $27,834,201 for the year. Total expenditures are $26,587,169. Your total excess of revenue over expenditures is $3,209,405. The accumulated surplus at the end of the year for December 31st, 2024 is $174,287,458. Okay. One of the big pieces that I always like to mention is your changes in accumulated surplus. It explains a little bit about what your unrestricted surplus is at the end of the year, your restricted surpluses, your equity and tangible capital assets, all those combine in what makes up that accumulated surplus. Your unrestricted surplus saw an increase of $11,873 for an unrestricted surplus balance at the end of the year of $1,159,834. Your restricted surplus saw a decrease of $459,640. A large portion of that was restricted funds used for tangible capital assets at $5,804,000. Your restricted surplus at the end of the year is $15,887,254. The equity and tangible capital assets saw an increase of $3.6 million, with the balance ending for the year of $157,240,376. So that total equals your accumulated surplus of $174,209,405. $287,458. The last thing I wanted to mention is the debt limits. So the debt limits for the town of Slave Lake, the total debt limit that's available for the town of Slave Lake is $31,460,175. The debt service limit available is $5.7 million. And like I mentioned, Roland's gonna go through that in much more detail. But overall, thank you to council, thank you to finance, administration, for helping us with the audits. They've done an excellent job. We are on time. It's April 15th. We're gonna be well in advance to submit this to municipal affairs before May 1st. And overall, extremely good job.
It's great to hear. Thank you. Roland.
All right, sort of a couple key highlights I'm going to point out before we even get into the report. It is a requirement of every municipality in Alberta that they're prepare financial statements every single year and that they are audited by an independent auditor every year. And I've included the section in the Municipal Government Act, section 2761, that states that. So just as general information to the public that not only is the town of Slave Lake, but every municipality in Alberta is audited every single year. For the town of Slave Lake, our financial statements are wholly prepared in-house by myself and my team. The auditing firm does not prepare the statements. We do. They just check it for accuracy and do their part in their testing. For the financial statements here, this report kind of just focuses on three primary components: the consolidated statement of changes in financial position, or the balance sheet, the consolidated statement of income, or the statement of operations, and the schedule of changes in accumulated surplus. Edward kind of gave the highlights on some of those. I'll just kind of go through and give a little bit more detail on some of the numbers within these statements. So on the statement of changes in financial position, so we did have a fairly large decrease in cash and temporary cash investments at the year end. We went from 8 million last year to 4 million at the end of this year. Most of that in large part is just timing differences from when we do this. We had received more of our grants in 2023 by the end of the year than we have had in 2024. So we are expecting to receive some of those grants that are we're waiting for money on from some of our projects. And these grants include the CCBF, or the Canada Building Fund, formerly known as the gas tax. There was $814,000 we were waiting on. We're waiting on the final payment for our MSI for $708,000. And then there was some LGFF with a new program. We were waiting on some of that as well. So that's kind of the big variance in the cash adjustment there. It just happened to be when we had done this, just a bit of a timing difference. Just a note on the report there, under taxes and grants and loan receivable, I have two wrong numbers in the report. It says 11 million. Our receivable actually is $1 million with an allowance for doubtful account of $498,000. So with that allowance for doubtful account, that actually is only comprised of one lot in town. So while it is a significant chunk, it is representative of only one lot in town that we're dealing with. Current taxes receivable overall, though, amounted to $308,000, which was down from $439,000 in 2023. So within a normal variance range there. However, it's kind of it's trending in a positive direction. You know, lower current amount, more people. We're getting our tax collection up. More people are paying. Our strategy of reaching out to people seems to be working. That's really kind of the only note there it had on the asset part. For deferred revenue, we do have a couple of grants here. So MSI, we had 563. We have our LGFF of $547,000, Fire Smart funding of $857,000, and the homeless shelter grant at 225 revenues. So what deferred revenue is, it shows up as a liability on the town's statement of financial position. That represents prepayment of grants or other revenue expenses that have yet to be purchased or incurred. So we don't recognize revenue yet. We'll do that when those monies are actually spent. Overall debt, I think we're doing good. The town continually is paying off its debt every year. With a large chunk of our outstanding debt is representative of the provincial building. So we're fairly unique in the province of where this whole building, about $8.7 million of our outstanding debt currently right now is supported wholly by the province of Alberta to pay for the back end of this building. That's really all I had for the highlights on the liabilities. On to the revenues. So we had user fees and sale of goods. We had $6.8 million for the year. So this category includes a variety of charges, anywhere from utility fees, cemetery fees, recreation program fees, as well as fire services revenue. Utility revenues for water and sewer basically met the budgeted targets for the year. We made what we said we were going to make. We spent what we said we were going to spend. The significant positive variance from budget within this revenue category in 2024 is largely attributable to two one-time revenue sources. So the one that we didn't have in the budget was the total sale of the residential lots in Fournier subdivision. This generated approximately $430,000 in additional revenue. And we also had fire services deployment revenue and training revenue, which contributed an unanticipated $441,000 over what we had budgeted for. On a year-over-year basis, revenue generated from user fees and sale of goods kind of remains generally consistent with prior years, with the increase in 2024 being reflective of these one-time events rather than ongoing operational changes. And then in 2023, again, while they're similar, we also had a one-time event in 2023, and that was also deployment revenue from the fire services. So on the average, we're seeing two fairly high years, and that was roughly attributable to these one-time events. Government transfers for operating. So this category includes a variety of grant funding from intermunicipal contributions to our police wage grants, our family and community services grants, fire smart programs, as well as some MSI operating funds. The variance from budget within this category is primarily a result of the homeless shelter ceasing operations partway through the year. As a result, the town did not receive the full amount of the budgeted grant funding originally anticipated to support the program. So that's why you kind of see this large variance from the budget to the actual operating for the government transfers for operating. Development levies. Again, generally, these amounts, we're never really sure exactly when we're going to collect these. These are triggered based on whatever happens in planning and development. As such, they're kind of you can't really anticipate them. While they show up as revenue here, all of the monies that come through the development levies are transferred to the respective reserves, depending on exactly what the levy was for. And so for this year, we had $203,000 in levies collected. In large part, these are the development levies on the Fournier lot sales. Licenses and permits. So we had $94,000 generated this year, mainly through business license fees as well as development and planning permit fees. The variance from budget here is primarily attributable to lower than anticipated business license renewals and a reduced number of development permit applications during the year. On a year-over-year basis, licenses and permit revenue has declined, with the reduction largely attributable to a decrease in development permit fees as development projects were initiated within the reported period compared to the prior year. Fines, we also have a fairly significant variance here. Again, this one, while we didn't generate the budgeted amount of revenue, this didn't really have a bottom line impact per se. On the fine revenue in the past, what's been budgeted here and earned here is photo radar revenue. And so we've discontinued the photo radar revenue program. So we're no longer generating that revenue. On the other hand, we're no longer putting that money into reserve. So bottom line, there's no, it didn't cost the town anything. We're just not getting that revenue. We're not putting it away. Franchise and concession contracts. So a little bit of a variance here. The biggest increase year over year is just because we had increased the rates. So within, slightly under what we had, ATCO had forecasted to generate for us, but up from the prior year. But it continues to be a stable and growing source of non-tax revenue for the municipality. Rental income. So we did have a little bit of a budget variance here, year-over-year increase in rental income. We did receive higher than forecasted revenues from our Big Fish Bay arrangement and some of the government center billing. There was additional billing that we had over there, which attributed some extra revenue. For other revenue, so on this, further along in the financial statements, for those willing to read them, basically at the end of the financial statements, there's a larger breakdown for other revenue at $1.8 million. It's a significant component of revenue. A lot of this, though, $201,000 of this revenue is for the Wildfire Legacy Center, which we manage. We had donations and contributions for the year for $42,000 that supported various community initiatives. A large chunk here was the revenue from the sale of the ATCO streetlights at $686,000. And then we had a one-time recognition of the Green Municipal Fund grant that we had for a sewer project a while back. That revenue had been deferred for a while. We had recognized it all in the year. And then there's a remaining $506,000 that is truly classified as other revenue, which primarily consisted of one-time adjustments relating to holdback adjustments and kind of some accounting issues that we had there that recognize that type of revenue. Some of these. So that kind of hits the highlights on the operating part there. I'll just switch gears here and kind of jump over to our capital. I just want to highlight some of the major capital additions that we did accomplish in the year and complete. So major capital additions that the town kind of completed in the year was 5th Street Northeast Road Project for $1.1 million. We had the 8th Street Northwest Waterline Project for $720,000, 9th Street Waterline Project for $581,000, the remaining sewer network expansion project for $568,000. We had a lot purchase in the southeast for $490,000. We purchased our Type 1 wildland trailer for $460,000. We had the sand truck again for $460,000. The downtown revitalization project, $405,000. Our ERP project for $368,000. We had the initial construction on our water treatment plant office for $217,000. Our total park improvements for the year was $270,000, and the total MRC improvements that we had spent was $210,000. So all in all, we set out to complete a whole bunch of projects, and I think we did. All of the projects that we had completed, one notable thing there, they all came in either on budget or under budget. I know some of the road projects, Chris had worked fairly hard and was able to complete those with a lot of under budget items, which left a lot more in reserves than budgeted for. Outside of that, it's got a little messed up here. The short and sweet of all that on my summary is just that. Sorry, lost my page here. For the highlights here, so for operating, the total operating surplus for 2024 amounted to $11,871. So after we raised all our money and spent all our money, we had about $11,000 left over that we can put back into reserve. This really indicates that the town raised and spent its resources in a balanced manner with minimal surplus remaining at the year end. So, I mean, the takeaway there is we raised taxes, we raised all our revenue, and we set out and we spent that. And I think on about $20+ million budget to have $11,000 left over, we really hit the bullseye this year on accomplishing what we set out to do with the funds that were allocated to us. Transfers to reserve for the year were $5.5 million. And transfers from reserves for operating were about $120,000, primarily for the economic development program. Our overall balance in the reserves decreased by $459,000, bringing our ending balance to 16 million. Our debt we continue to pay our debt off with the $18 million. 10 million of that is tax supported, with 8.5 million of our debt is funded by the province. And with that, the auditors gave us a clean opinion. Overall, it was a good year.
Pardon?
Ask your question.
My questions are, this is already presented to us, so, and during that time, we've seen all of the financials through budget extensively. And I agree, I think the financials have been appropriately presented. I really, it's a very boring, for all this work to say it's a very boring financial statement, but I guess that is ultimately what we want, is a boring financial statement, in the fact that everything presents fairly. And it is very clean. As Edward mentioned, the report in this package is incredibly detailed and answers just about every question I think you could have in the financial statements. And that is in addition to the financial statements notes, which there's 30 some odd pages of financial information there as well. I think it's very transparent, and I really appreciate the level of detail in the report. So I actually have no questions on this budget and just want to thank your department for the work. Yes, Councillor Adams.
I'll just say I'm very happy that we got the unqualified opinion. Yeah. And I like to say good job for you and your team. It's good to see, because I know there's a lot behind the scenes that happens there. So I appreciate that. And honestly, with that, I'll put a motion forward that council adopt the financial statements and the financial information return for the year ending December 31st, 2024.
Motion on the floor. Any further discussion? All the questions in favor. And that is carried. Thank you very much.
Thank you, Edward.
Switching gears.
Roland, you don't want to do this one too?
This one doesn't have quite as many numbers as the last couple of reports, so thank you, Mayor and Council. I'm joined by our Acting Fire Chief, Mike Bissell. The first report is to discuss a reallotment of capital budget funding from a 2025 approved budget for cots and trailers to emergency rescue tools. So in 2025, $118,000 was approved to purchase 2 utility trailers. Yeah, I apologize. Technology right when it ends. And as well as cots and blankets. The trailers have been purchased. The cots and blankets have not been purchased at this time. In the last couple of months, our jaws of life, for lack of better terms, one of the pieces of equipment has had a couple of critical fails, and I'm just trying to catch up on the report, so I apologize. So what we are asking for today is to reallot the remaining $74,000 to purchase a new set of jaws of life. So the rescue tools are typically 15 years old, according to the manufacturers and NFPA recommendations. This set would just be around the 14-year mark. The unfortunate part is with this type of equipment is technology changes. So the current set that we have is all hoses and a pump, and it's heavy. The new technology is all battery operated. In 2023, we switched the MD to all battery operated tools. They're very well received. It takes less manpower to move them around and to use them. But it makes it harder for the equipment that we have now to be repaired. So what we can, if the cots and blankets that were on the capital budget we do choose down the road to purchase those, we could bring that back for a budget in 2026, 2027. What we'd like to do with the 800 cots and blankets we have now is put them into the 2 trailers we have ordered. Makes it easier for deployment, easier to move around when needed. And then the purchase price of the new rescue equipment is around $71,000. So we would still come under budget of the allocated funds that were originally set forth for this original project.
Councillor Gramlich.
Just like to point out, the fire department traditionally has always stretched out what they need, right? The vehicle will make it last 3 years longer. They've always found a way to save money, and while being the only department that actually makes money somehow, which is odd for a fire department. So I appreciate that they're still not spending any money. They're just moving money around to get jaws of life, which are far more important than an additional 800 cots. So I'm heavily in favor with this, and if I'll make a motion, if no, Councillor Adams would like to talk, so go ahead.
Yeah, I-
Of course I have a question.
Yeah, what am I thinking? Why would you want to talk?
Go ahead, Councillor Adams.
Alex, okay, so as far as the rescue tools go, I know it's coming up on its life expectancy and was it budgeted for within the plan to replace that in the 15 years?
Yeah, it would have been in 2027.
that
That's
in
why it hasn't come
reserves?
forth yet in 2027.
Right.
So yes, it would have been. It's on the 10-year capital plan. It hasn't come forth because it's still 2 years away.
So then with that money that we're putting away, how will that be reallocated?
It would just stay in the reserves for future, as we're starting to see with
Cost.
expenses, tariffs and things like that. As the capital purchases come, it would just be reallocated down the line for the next piece of equipment. So there'd be no plans for it right now. This would bring our tools again up to speed for the next 15 years.
Okay, I do see the definite difference, like you're saying, within the priority level of a cot for a maybe and a jaws of life for it likely will be used.
Yeah.
So I appreciate that. I am, same thing as Sean, quite in favor of this.
So I caught up in my report. I want to say the set that we had, the tools we have now, normally what we talk about is selling them off or in this case, we still want to hold on to them and use them for training. This will allow the new tools to have a bit longer lifespan. So we'll keep them basically until they're as part of our training, which you guys are aware of the training division. So we'll hold on to them for that purpose.
That was basically my question. So I just wanted to reiterate. So we had 2 fails on one, so it's being repaired and you have a loaner. So we're going to buy a new one. So we'll have a new one and we'll have a repaired one.
Yeah, so it's new. So not saying one. So the equipment it amounts to about 10 different pieces of equipment.
Okay.
Batteries and tools and things. We call them cutters and spreaders. So the one tool that's failed, it is being shipped back to us shortly. If it does fail again, we probably won't put the money into it to fix it, but we can keep the other sets, the other tools that are there for training
Okay. Yeah.
until they basically become no longer usable. They're not worth anything because of the new technology. Nobody's buying these used. We could donate them to Mexico or something, but we can keep them for our own program that we're running.
And
as well.
training
Right.
facility.
And
Okay.
give us longevity on.
And do
Longevity on
we
the-
only have the one set for our, like for at our fire hall, or how many of these do we have?
So what
for
we,
service?
there's the thing called the combi tool. So it's basically a cutter, a spreader, like a one, all in one.
Yeah.
So it would do light rescue, I guess. That's on our frontline engine.
Yeah.
And then this is the heavy pieces of equipment. So, the bigger equipment, the longer extrications, that's on the rescue truck.
Okay.
So the way we have it set up is there's so we call a full set of tools in Flatbush. So at that end of the MD.
Yeah.
And then this set of tools in Slave Lake. And then the other stations have what we call a combi tool. So it's smaller, lighter. You can get there quick and start on the job, and then the bigger equipment would come as required. So we kind of strategically place heavy equipment and lighter equipment throughout the MD.
Okay, but it's not like we have the full set of these at every single hall
No,
or
no.
anything by any means then.
Oh.
Okay. Okay, thank you for clearing that up.
I just have a question on the sorry, I keep not turning this on. I have a question on the motion. Roland, the money man, might be able to clear this up. The motion's to approve the purchase of emergency rescue tools, but do we have to put as reallocated?
Yes, I should have done that.
Yeah, just curious, like, so it's done
When
properly.
you make the motion, you can add that.
Yeah, Steve had another question, I think, though. Okay. Like to make a motion to approve the purchase of the emergency rescue tools for $71,094 plus GST as a reallocation from the cots and trailers we were going to purchase.
Okay, there's a motion on the floor. Is there any further discussion? Call the question, those in favor. And that is carried. Thank you. And continuing on.
Okay, so I'll try not to shut the program down while I'm starting on this one. So thank you again. So this report is to provide yourselves with information regarding a new Type 6 wildland or interface response unit. So to make that very simple for you, it's a 1-ton truck with a unit that could go in the back of the truck for fire season. It can pull trailers. It's a heavy pickup truck. When the fire season is not that high, we can take that out. We can use it to haul hose. With the new team, they would also use it to go to training and events like that. So since 2019, as you're aware, we've been reviewing the capital fleet. We did downsize our fleet a couple of times in the last 6 years. We didn't really, we didn't have this team anymore. We were transitioning to a different model. In 2025, recently, we were awarded a new WUI team. This truck would be an added piece of equipment. So we did bid on the team with the equipment we have. Once we got the team, we found that an extra piece of equipment would help us. It would help our response. It would help the provincial model. We currently do have this type of equipment, so it's not a brand new piece of equipment. It's something we already use. And it's also part of the grant. The revenue from this truck, from this piece of equipment comes to us. So it doesn't go back to the province. It doesn't go to anybody but us, back to our department. And the opportunity arose in 2021 when the Fire Smart grant ended and both councils, town and MD, agreed to transition to the full-time staff. There was a pool of money that was left. At the end of 2028, when that grant runs out, there's about $400,000 remaining that was decided we would see where we needed that. So now that we have this new WUI team and the ability to kind of grow that pot again, we're requesting to take some of that money to purchase a new piece of equipment for the team to help them to do their job quickly and efficiently. The reason that we're coming to this now is there was a truck that kind of skirted the potential tariffs and issues, things like that. It was outfitted with lights and sirens. There's a very quick turnaround time on it. And then the purchaser walked away from it. They decided they didn't want the equipment. So we could have this truck fairly quickly within the next 14 to 21 days in our hands, ready to go. So the request is for, with the skid unit that would go in the back, about $180,000. That would include putting a new radio in it, getting the decals on it to match the rest of our fleet and getting in service. And the sooner it gets here, the sooner it can go to work and start potentially putting some of that revenue back into our pockets.
Councillor Adams.
So then what's the life expectancy of the vehicle? And then I imagine the skid is longer. So what's the life expectancy?
So our pickup trucks up till recently were 5 years. Now that we have more than one mechanic working for us, we've started to elongate that process to more of a wear and tear. So we're getting 7 to 10 years average. On what we're finding on the diesel trucks, we can even extend that into 12 to 14 years. They do last longer typically as a diesel truck. And the skid units, we've got some that are from 2011 that are still working fine. They get maintained every year. They get serviced annually, post and pre fire season. So we don't really have a lifespan on the skids. They're kind of one of those things that go until they're no longer. And if the pump goes, we can put a new one on. The tank is still there. The base of the unit is still there, so they're pretty easy to replace small bits and pieces, but we don't really have a lifespan on them because they don't really stop being used.
Is this then something that will also be used? Is this then also something that will be utilized within our community if it's needed? It's not just dedicated to the provincial, right?
Correct. So we do have other types of this truck. This one could stay here, depending on the deployment, depending what the request for the deployment is, if they want a different type of truck. At the end of the grant, which is in 27 months, if it's not renewed or extended or anything like that, this truck would become part of our fleet for the entire region as part of our Lesser Save Regional Fire Service.
Thank you.
Councillor Adams.
I'd like to make a motion to approve the purchase of a new Type 6 Wildland Urban Interface Response Unit and portable firefighting skid unit utilizing an unallocated Fire Smart program reserve of up to $180,000 plus GST.
Okay, motion on the floor. Any further discussion? Call to question, those in favor. And that is carried. Okay, moving right along into question period. Is there anything for CAO or administration? Councillor Hughes.
Beat you, Steve. Yeah. Alex, I am just curious if you have been in touch with Gord from Transportation lately. By any means, last year we had about 3 or 4 times, I think the town basically emailed and just said, hey, I just want to make sure that you're aware of the several potholes on 88, kind of when you go from 6th Ave to head north on 88. There's several like right in a span that are getting pretty deep already. And I just know from my experience last year, we kind of had to email and email again and kind of bring it to his awareness. So I'm sort of attempting to do the same thing right now and saying, hey, I'd love for us to reach out, highlight that issue so that it could be fixed sooner than later. I do think people in town may think that they are our responsibility and they are not. So I would like to pass that along. I don't know if you want me to make an official motion, but I was just curious, I guess, if you are in contact with him kind of consistently and could mention it or,
I haven't recently, but I can definitely reach out to him and have that conversation.
okay, perfect. That's it for me.
Okay, do we have anything for, Counselor Choba, go ahead.
No.
No, nothing? Okay.
Oh,
Anything,
excited to see what it was.
anything for State of the Lake? There we go.
All right.
Go ahead, Counselor Choba.
Thank you. I'd like to take a moment to recognize and celebrate the upcoming graduation of 6 students from our fire/primary care paramedic program this Friday, or this coming Friday, April 18th. This is a long journey filled with dedication, resilience, and hands-on learning. While they still have a few medical requirements to complete, reaching this milestone is no small feat. We're incredibly proud of their hard work and commitment to serving our communities. Congratulations to the graduating class. Thank you.
Fantastic. Anything further for Counselor Hughes?
Yeah, I just wanted to mention, today I learned that there will be a coffee with a cop, held on April 30th, from 2 to 3 at the Fix. And I also just wanted to give a shout out and say thank you, to the Filipino Association here in Slave Lake. They had their Pinoy Fest, this last Saturday. Councillor Choba and myself attended, and it was a really great event, very well done, so much fun, so much culture to experience there. There was dancers, there was amazing food, and just really highlighted, the Filipino community and how welcoming and wonderful they are and how lucky we are to have them in our community too. So I just want to say thank you to the organizers and everyone for all they did. It was great. And I know my daughter enjoyed it too, so we can't wait to attend next year.
Fantastic. Motion to Counselor
Go ahead.
Glick. Very slow.
Motion to go into closed session.
Any further discussion? Call to question, those in favor. And that is carried. Thank you.
You, Steve, that's called taking turns.
He waited. His hand was down.
Did. He
touching
was
the
like,
table.